You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. We're very pleased to have in studio an internationally recognized lecturer, author, and educator in the treatment and cure of sleep apnea and TMJ. So if you snore, toss and turn at night, are always fatigued or tired, have chronic neck or shoulder pain, have a child who's undersized, still wets the bed, has difficulty focusing, or has even been diagnosed with ADD, then you don't want to miss what our guest has to say. So stick around. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. Our guest today is Dr. Brock Rondeau. Dr. Rondeau is a member of the American Academy of Dental Sleep Medicine, a diplomat of the International Board of Orthodontics, and a diplomat of the American Academy of Craniofacial Pain, a small and select group of dental professionals specializing in the treatment and cure of sleep apnea and TMJ. Dr. Rondeau's practice in London, Ontario, is recognized by patients and peers alike as a cutting-edge facility in the care and cure of these disorders. Dr. Rondeau, welcome to the show.
Thanks, Mike. It's nice to be here. Thanks for inviting me.
All right, I brought you on today to talk about sleep apnea and TMJ. But before we get into that, give me a little bit about your background, your history. Now, you teach all over the world dental professionals how to care for these disorders. Tell me how you got into that.
Well, I guess I'm a general dentist, first of all. I've been a general dentist for a long time. You can tell that from the gray hair. And basically, I started wanting to help children that I saw that had malocclusions. That means bad bites.
Okay.
Children with bad bites.
Overbites, underbites?
Overbites, underbites, receded jaws, whatever. And so I started treating these kids and getting very fulfilled because I would significantly improve the profiles. And later on in the program, I'll show you some before and afters that I've done. Really impressive, I think, how you can change the facial profiles of these young kids.
Is it easier to treat at an early age? I mean, can you catch it early?
Oh, much easier.
All right, so you started to help the children, and what happened from there?
Well, 90% of the children's faces develop by age 12. So if you want to guide the growth of your younger patients, you have to go in early. Now,
I don't mean to interrupt you, but do you think most parents realize that if they get involved, if they catch this at an early age, they can have such a tremendous effect on their child's life as an adult?
No, I think the dental profession hasn't done a very good job of letting patients know that. And there's been no TV programs, there's been no radio programs on this, and really, that's one of the reasons I was glad you brought me on today to try and enlighten parents as to what kind of treatment they could get for their kids so they could prevent problems later on.
Okay, so you started by treating the kids, and we're going to get into that a little bit. And then how did you transition over into helping the adults?
Well, I started using functional appliances on these children. And these little functional appliances would move the jaw forward.
Okay.
And make their profiles look better. And I would also open up their airway when I brought their jaw forward. And so the kids would breathe better, and they would do better in school and everything else. And then what happened, I had a number of parents say to me, I have headaches, and you got rid of my little girl's headaches. Could you do the same for me? And the number one symptom of TMD is headaches.
Okay. Sleep apnea, the same thing? I mean, what is sleep apnea? Let's just start with that right now. Okay. What is sleep apnea?
Sleep apnea is when a patient stops breathing for 10 seconds or more. Now what happens is they stop breathing for 10 seconds or more, maybe several hundred times a night. And that blocks the airway, and that reduces the amount of oxygen the patient gets, and then they have an arousal, and they wake up. And they wake up several times a night, and that really makes them very fatigued the next day. When you wake up all night long, you're not getting a very good sleep.
So you're tired, you're listless, but you said in children, you notice the exact opposite.
That's right. What's really funny what's really interesting is that the children they don't get fatigued, they get hyper. And they get a condition called attention deficit disorder, which is ADD. And then they're hard to handle because they're aggressive and they're excitable and they're hard to handle in school. So they tell the teachers tell the parents, what are we going to do with these children? I can't control them. So the medical doctors then put them on medication Ritalin, which is a stimulant. You wouldn't
Right.
think a stimulant would calm people down, but it calms the children down.
Because it's doing the exact opposite of what not having the oxygen is really doing to them. Now, I don't mean to put you on the spot, but I've had some discussions with you, and I know that you have taken children that have ADD, that are on Ritalin, that you've put in the appliance, that you've worked with them, and you've actually, they most times are able to come off the medicine.
Absolutely. I mean, you can give them a new drug. It's called oxygen.
Now, tell me about that, because we're going to show a video clip you brought of what sleep apnea is. And I talk to you about every now and then my kids tend to breathe heavy. You know, my kids are good size, but they tend to breathe heavy, and every now and then they snore. And you said that that's not something.
No, snoring is bad. Snoring, it means there's an obstruction in the airway. If you have an obstruction in the airway, then you're getting less oxygen than you're supposed to get, and you get all kinds of other symptoms. So the main problem of children that snore, they have large adenoids and tonsils. So they need to go to a dentist that has a potential to take an x-ray, cephalometric film of the side of the head, and check to see whether or not their tonsils and adenoids are enlarged. If they are enlarged.
When I was a child, almost everybody got their tonsils out. If you got the flu, your tonsils swole up, they chopped them out. Today, it doesn't seem like anybody wants to take them out. So they sit in the back of the throat, and you're saying that they swell up, and then the kids can't breathe.
That's right.
And then the adenoids you can't really see.
That's right.
They're up behind, but they swell up. Okay. So opening up the airway allows the oxygen to get in.
Right.
And then not having that oxygen in the child causes them to become hyperactive, you said?
Hyperactive.
Not be able to focus?
Not be able to focus
Now,
in
you
school.
said still wet the bed.
Yeah, they still wet the bed.
Why would not breathing cause them to do that?
The lack of oxygen causes that problem.
All right. Well, let's take a quick look at the video clip so everybody can understand really what sleep apnea is.
Okay.
So let's roll the clip. Tell me what's going on here. So here's a lady that's just sleeping. Snoring?
Snoring now, yeah.
All right. No big deal. Everybody snores a little bit. But then she seems to stop and lock up. So what happens in the throat?
What happens is when they lie on their back, particularly, their tongue falls back. And you see there's the tongue fell back, but there's a little space, so it's snoring. And when the tongue completely blocks the airway, it's apnea.
Okay. Now, when you have apnea, when the tongue completely blocks the airway, you say they wake up, but they don't remember it.
That's right. Anytime your oxygen level goes down below 90%, then you have a problem, because then the body says we're not getting enough oxygen, and so the brain gives a message to the lungs to start breathing again, and that wakes the patient up.
Because otherwise they'd suffocate.
It's called an arousal.
Okay, how does that, I mean, they still sleep all night. I mean, they're in bed 8 hours or 10 hours. How does that translate into them feeling tired or fatigued the next morning? I mean, they still were in bed for 8 hours sleeping, right?
They have the partial wake-ups called
Okay.
arousals, maybe 50 times an hour. And then they're exhausted when they wake up. I always ask my patients, do you feel refreshed when you wake up? Are you tired during the day? That's the #1 symptom of sleep apnea.
Fall asleep at the movies or at the stoplight in the car? Or
That's
warm,
a severe case.
falling asleep in front of the TV?
Yes.
Just tired, listless?
Yeah.
Now, you told me that because of the apneic events, they don't ever get into what we've heard called REM sleep.
That's correct.
And what happens in your body during REM sleep that's so important?
You dream, and your body totally relaxes. So the patient's not dreaming. That's a very good sign that they may have sleep apnea. But also your spouse is the one that's really got to tell you if you have it, because your spouse will be upset because you stop breathing.
Right.
And they're concerned that you've stopped breathing, and they think you're going to die. And you will die unless the brain wakes you up and you have this arousal and start breathing again.
Okay. I want to know, we're going to get into why you think people don't pursue treatment more. I know why I think. We have to take a quick break. When we come back, we're going to talk a little bit about the CPAP. We're going to talk a little bit more about oral appliances that can cure this, and a little bit more about what people really need to know to understand how big a problem this is. How many people did you tell me TMJ and sleep apnea in North America?
Well, in North America, 90 million people suffer from insomnia, which is inability to sleep, snoring, and sleep apnea. 90 million people. That's almost a third of the population.
And of those treatment options, you don't ever really see, I mean, we see signs, don't let friends drive drunk. We don't see signs that say don't let friends drive sleepy. And getting ready to come talk to you, I have a lot of friends in the law enforcement business, and a lot of them are highway patrolmen. And I found out from them that sleepy and tired drivers cause far more accidents than drunk drivers.
Right.
But yet we never see that addressed.
If you have sleep apnea, they will not give you a license to drive a motor vehicle.
If you have severe
If you
sleep
have
apnea.
severe sleep apnea, you have to be under treatment.
All right, well, we're going to go into more of that when we come back. We have to take a quick break, and then we'll get into that discussion. You're watching Medical News Network. I'm Mike Wittgenstein. We're in the studio with Dr. Rondeau. We'll be right back.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
Oh, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community.
Too strict. You're too
ConnectForKids.org, guidance for grown-ups.
Welcome back. We're in studio with Dr. Rondeau talking about sleep apnea and TMJ, a condition that affects close to 90 million people in North America. All right, Doc, before we went to break, we were talking about sleep apnea in children, sleep apnea in adults. I mean, does it really have a particular person it affects? You told me you've treated children as young as 4 or 5 years old.
I think the big thing, Mike, is prevention. If we can prevent these problems with the children, then they'll never have sleep apnea and they'll never have TMJ problems. And so that's why I like using these functional appliances to bring the jaws forward. When you bring the jaw forward, you bring the tongue forward, open up the airway.
Okay, now I want to tell you, when I first started learning and I heard bring the jaw forward, I'm thinking, when I did research, there are doctors that do surgery to cut and move the jaw forward. It sounds like it is a very involved, painful process. But you're telling me there's basically no pain at all.
No pain at all. You wear an intraoral appliance, like 2 retainers that bring the jaw forward. It's very, very easy.
Now they wear those at night when they sleep?
Wear those at night when they sleep.
Okay, now show me again what it looks like, because I don't think people, this is for an adult.
First of all, there's about 90 different designs, but certain dentists have certain designs that they like the best. But this particular design, it's very simple. And you can see it's got a little hook hanging down here like this, and this hook under here, and that moves the jaw forward. And the jaw can't fall back at night.
And so if the jaw can't fall back, the tongue can't fall back, which keeps the airway open.
Absolutely. It's a very simple principle.
All right, now show me the one you did earlier for the children that most of the kids go in. You called this a twin block?
Twin block. This is a twin block appliance that also keeps the jaw forward. It's got 2 blocks that interlock at 70 degrees.
Now, can they open their mouth and close their mouth? I mean, because the little kids, obviously, if their mouth was stuck closed, would be probably a little claustrophobic.
They can open and close, but they only close in one spot, because if they put this block on top of that block,
it just makes it slide forward. And
they can't close. So they always bring the jaw forward, close like that, and they do that. If they wear that appliance for 7 months, the jaw stays forward, the tongue stays forward. They never have sleep apnea. But now the only other thing with children, you have to make sure that there's no large adenoids or tonsils. Get those tonsils and adenoids out.
Now, but if you went to the dentist, if they came to you, the mom and dad, and they brought their child in and you saw that, you would then refer them out to have the tonsils removed first.
That's correct.
Okay.
We work with the ear, nose, and throat specialist to do that.
Okay. The reason I really wanted to bring you on, was because obviously early prevention. But as you become an adult, and up until recently, obviously, you've told me oral appliances have been around, but they've not been used. It's my understanding that if you were diagnosed with sleep apnea by most medical physicians, went to a sleep lab, got your thing, from mild sleep apnea to severe sleep apnea, you ended up with this, which is a CPAP, right? A constant positive airway pressure, which basically is like a reverse vacuum cleaner. Instead of sucking in, it just constantly blows. I mean, if you look at this, and I'm going to talk to you about the numbers of people around. You're hooked up to a hose. You're in bed. I mean, if you rolled over to your significant other or your husband or your wife, this is not the most romantic thing in the world. And I can't imagine it's very comfortable to sleep in. And you always have pressure blowing down your nose. People that have this, get it, need it, wear it. I have friends that have them. They don't wear them. How many people after a year are probably still using this?
Probably 80% of the people that are given that don't wear it after a year. The only ones that wear it are the ones that are really severe, when they're, say, 350 pounds and they've got big necks, and they absolutely have to have their airway opened up with that by blowing air up the nose. It blows out away the tongue and opens up the airway. Those patients need it.
Do you think there are people that don't go, and I'm going to tell you, I am one of them. You know, one of the reasons I want to talk to you is the ease of the appliance. You told me I probably have sleep apnea of some degree, and I do. I have a big neck, and I'm overweight, but I'm not wearing that. No. And I don't think I have a severe case. I mean, obviously I could be okay with an appliance, but why do you think a lot of people, I mean, 90 million people is a lot of people. Why do you think they don't go get checked? Do you think they're afraid they're going to get the CPAP machine? Yes,
I think it's a matter of education too. A lot of patients don't know that oral appliances will work. There's nobody really advertising that oral appliances will stop snoring and sleep apnea. That's one of the reasons I want to come on the program, to help educate patients, let them know that something can be done other than that. Most of my patients come in with that, and they say they can't wear it, and they want an alternative. They want to stop the snoring, they want to stop the sleep apnea, they want to stop the snoring because their wife is very upset. And actually, usually what happens is the wife drags the husband in kicking and screaming.
Okay, just to be fair, does sometime the husband drive the wife in kicking and screaming?
Once in a while.
Okay.
Women after menopause,
yes,
their fat sometimes goes their neck, and they run into problems also.
Real quick, just because you said a woman with a neck circumference of greater than
16 inches
is
susceptible to sleep apnea.
And a man 17, did you say?
More than 17, and I can see you're more than 17.
I'm a little more than 17 now. Okay, now I come in to get checked, to get started, to see if an oral appliance will help me, because obviously, you know, everybody's scared. They want to, you know, make sure nothing's going wrong. You brought a little appliance to show me that you give people to see if the oral appliance is going to help. Will you mind?
Yeah, sometimes we'll use a little temporary appliance.
Okay.
This is very inexpensive. Put a little temporary appliance in and see if that works.
The temporary holds the jaw forward with just that little paddle that sticks down.
Yes, the jaw fits in front of this little
and then if you have success with that, for those that weren't worried, then you move on into the other appliance.
That's right. That's one thing we can do. But some patients want to go right to the permanent appliance because they don't want to go to the temporary appliance.
As an adult, we've matured, we've grown. Can you still move the jaw? I mean, can you have success with that, or is it something that's, you know, once our jaw is in place, is it pretty much there? We're going to have to wear the appliance for the rest of our lives?
They'll probably have to wear the appliance the rest of their lives, just at night.
Just at night.
So but if you go to bed, they just put it in. They wake up in the morning, take it out.
But if you catch it as a child,
if you can prevent it, that's the thing. I mean, if you can get a child, usually, Mike, it's the patient with a jaw that's too far back. If you look at the profile, you'll see that the lower jaw is back. If that's the case, those patients need functional appliances when they're younger. I start with 5, 6, 7, 8, 9, 10, 11.
Can you literally move their jaw forward?
Absolutely, and it'll stay there. If you do it when they're actively
Because you see them, it comes down from their nose, you know, your lips, it's supposed to be kind of flat, but you see that chin that looks like it's, you know, it's gone away. You can literally cause that to move forward with an appliance.
Absolutely. I'm going to show you some pictures after that you won't believe.
Okay.
Cases that I have treated.
All right, Doc, we have to take another quick break. We come back, we're going to look at some of your cases, some before and afters, and just get a general idea of exactly what it is you're able to do with the appliances. You're watching Medical News Network. I'm Mike Wittgenstein. We're in studio with Dr. Rondeau. We'll be right back.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're in studio with Dr. Brock Rondeau talking about sleep apnea and TMJ, and especially how it affects children. All right, Doc, before we went to break, we talked about the appliances, we talked about being able to help kids and change things, but one thing you really made a point to me was, as a parent, if we have a child that has a condition like this, and we know about it, obviously if people don't know, there's nothing you can do, but we have a choice to make. We can either help them get treatment now, and you said after 6, 7 months, 8 months, they can correct the problem so for the rest of their life they don't have a challenge, or allow them to grow, go out on their own, and they'll spend the rest of their life working to fix it. Why, as parents, do you think more aren't bringing their kids in to get fixed?
I think the parents are bringing them in to get fixed, but it just depends on whether those dentists have been trained to evaluate those problems and whether the orthodontists that they refer them to want to treat early. Some orthodontists prefer to wait until all the permanent teeth are up. I'm of a different school of thought. like the Europeans, I like to treat early. Why not solve the problem when the patient's actively growing, then try to deal with it once all their permanent teeth erupt? I'm into early treatment.
Is just having orthodontics done enough to ensure you don't get these problems?
I would say no. Orthodontics is just basically straightening the teeth. And it's important for orthodontists or general dentists, whoever's doing the orthodontics, to make sure that they have a healthy temporomandibular joint. If no attention is paid to the temporomandibular joint and you just give straight teeth, some of those patients could have problems later on. The patients that have the worst problems are the deep overbites and the jaws that are retrusive, weak chins.
With that being said, let's pull up your first case that we're going to go over here. Now, tell me about this little girl. She is 10?
10 years old.
And I mean, until I started talking to you, I see half the kids at school where my children go to school have this profile.
Yes.
I mean, is this a pretty...
This is a very serious problem in our society. Most kids have an underdeveloped jaw, and they need to be brought forward when they're actively growing. So that little girl would probably have some jaw problems. She could have ring in the ears. She could have headaches.
Now, we talked, you said neck pain.
Yes.
Okay, she came in because to you, she had neck pain. Was that one of the...
Yes, yes.
And in a young child, unless they just had a traumatic injury, they shouldn't normally have neck pain.
No, they shouldn't.
Soreness, anything like that. So take me through what you did for her.
Well, basically, because her jaw is retrusive.
That means just back.
Back, because her jaw is back too far. She's got forward head posture, so her head tips forward, and for every 1 inch that her head tips forward, it puts 10 pounds of pressure on the muscles in the neck.
Okay, let's look at the picture real quick. You told me that their ears should pretty much line up right over their shoulders.
Yes.
And you can see her shoulders put her ear about, halfway back of her head.
Maybe 4 inches.
Okay, so that means that her neck is holding up an additional 30 to 40 pounds in weight.
That's right.
Which is why it's sore.
That's right.
Okay, so what did you do to help her?
When I bring her jaw forward, bring the next picture up.
Okay.
When I bring her jaw forward, you're going to see her head uprights over her cervical spine. Her head went right up. So I brought her jaw forward.
Hold on, I'm going to back up to that first picture for just a second.
It's kind of
her head seems to be almost angled down.
That's right.
And in the second picture, we'll put them up there side by side. You can definitely see that her head is up, it's square, her jaw is now out to her lips. And you're telling me this is all because?
All because I used a functional appliance to bring her jaw forward, and the cause was her lower jaw was deficient.
I mean, if you even look at her eyes look more alive. I mean, she has...
Well, plus self-esteem. If you have a weak chin, the kids will make fun of you, because then if you have a weak chin, you got buck teeth, because there's a difference between the upper and lower teeth. It's called an overjet. And so the kids make fun of them, calling them buck teeth, and so their self-esteem suffers. But I'm talking about the reason I use this is not just for self-esteem, but also to help their health. Because remember, when I bring the jaw forward, I help the TMJ problem, help the jaw problems, because many jaw problems, and we'll show some videos later, are of the jaw being back too far.
Okay.
So I'm bringing the jaw forward. I'm also bringing the tongue forward, which is going to help prevent snoring and sleep apnea. Because when the tongue falls back and blocks the airway, that's what causes the snoring and the sleep apnea.
Okay, now you brought this little girl's jaw forward using just an oral appliance.
All her problems are gone. Headaches are gone. Neck problems are gone. She's a happy little girl. And then I'll put the braces on and straighten her teeth. So I fix the bone problems first.
So you fix a structural problem.
Structural problem first, then I fix the teeth.
Then you fix the teeth. All right, let's go to I believe your next...
He was 7 years old. And for sure, those kids were making fun of him. I mean, you can see his jaw is way back.
What do you do for him?
I bring his jaw forward with one of those twin block appliances like I showed you earlier.
Same thing?
Same thing.
And this is this kid?
This is him about 10 months later. Looks like a completely different individual. Nobody's making fun of him now.
Now, let's take a look at his teeth real quick, and you can tell me what's going on here. This is the picture of his teeth?
You can see that his back teeth are 9 millimeters behind his upper front teeth.
So now this is looking at him from the side.
That's right.
The 2 teeth on the right-hand side that are pointing almost straight out are his...
Top teeth.
Top 2 front teeth.
Yeah.
That's incredible. And with the oral appliance moves the jaw. Now, did this kid have orthodontics also?
Yes. After I moved his jaw, you'll see, there's the position his jaw's in after 12 months. Then I just wait till all the rest of his teeth erupt and then put braces on and give him straight teeth.
But now you've brought that lower mandible out to match where it should be, and
That's right.
And then we brought the teeth back to some degree.
Yeah, we brought the lower jaw forward,
Okay.
And we fixed the structural problem because he had a bone problem. His lower jaw was deficient. You can't fix lower jaw deficiencies with just braces. You have to use functional appliances. And I've been doing this for the last 25 years. And I really like the results I get. And a lot of parents, the ones I talk to, want their children to be treated early. They don't want to wait till problems develop when they're more expensive to treat later on.
All right, Doc, we're almost out of time, but with TMJ, you mentioned it. Take a moment and just explain what it is and how it works. It's basically a dysfunction of your jaw joint, yes?
The public call it TMJ.
Right.
But the medical and dental profession call it TMD, temporomandibular joint dysfunction.
Okay.
It's a disorder of the TMJ.
All right, you brought a clip. Let's take a look at it real quick and kind of explain to me what it is. This is a clip of, that's a jaw joint, right?
That's a jaw joint.
The bottom is your jawbone, your mandible that you chew with, and the top is the joint it sits in.
Right.
Now, okay, so under normal conditions, it just kind of goes back and forth nice and, what's the orange part?
The orange part's the disc. That's the protective piece of cartilage between the two bones, which allows the jaw to move nice and smoothly.
Okay.
And protects the two bones.
Okay.
And then the yellow part is the nerves and blood vessels behind the jaw, and you don't want that jaw to go back too far. And that's the problem with those little kids with those buck teeth. Their jaw's back too far, and that's why you have to move them forward with those functional appliances.
So if it goes back too far, it presses on the blood vessels and the nerves back there, kind of like stepping on a garden hose, shuts off the blood, so they get the headache, they get the tense, their head goes forward to try to relieve that, and then they start getting those neck problems and pains.
Right.
So over time, now, is this a progressive problem? Will it continue to get worse?
Yes, it is. There's 5 stages of disc displacement. We'll show the disc going out of position shortly.
Okay.
Now
we notice
the disc is out of position now, and you can see the patient is going onto the disc. See how much thinner it is.
Right.
And when they go onto the disc, that's the click you hear. So if clicking is bad, if you hear any noise in the joint, it's bad. Any noise in the elbow, any noise in the shoulder is bad. Noise here is also bad.
Eventually, it breaks through.
Breaks through, then you get a perforation, and you hear a cracking noise. Call it crepitus. Not good, because then it's bone on bone, and then the top of the jawbone starts to wear down. And those patients are in a lot of pain. Because frequently, too, what happens is the nerves and blood vessels get very compressed on that.
Can you help them also?
They're more difficult, but we can help them.
We are out of time. If everybody could take home one message from today about sleep apnea or TMJ, what would you want it to be?
Get your kids in early. Any child that has buck teeth or has their jaw too far back, get them in early. Get them wearing a functional appliance. Get that jaw forward.
What if your kid snores?
Well, that'll help too, because and look at the adenoids and tonsils. Get those adenoids and tonsils out.
When you open your child's mouth up and look in it, should you be able to see down?
Yes, you shouldn't see 2 meatballs at the back of the throat.
Or the tongue and the drape meeting together.
Right.
All right, I want to thank you for coming in. You've been very
pleasure,
informative.
Mike. Yeah,
thank you.
It's good.
You've been watching Medical News Network. I'm Mike Wittgenstein. For future information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.